Hello people, welcome to Crazy Farm, and in this video we will see about antiretroviral drugs. We have 6 classes of antiretroviral drugs: nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, protease inhibitors, and entry inhibitor like enfuvirtide, CCR5 receptor inhibitor like maraviroc. We have integrase inhibitors like raltegravir and dolutegravir. If this is the first time that you are looking at these drugs, it's preferred to pause the video and make sure you get familiarized with these drugs before we move on further. Now let us talk about the mechanism of action of these drugs. We have maraviroc, which is a CCR5 receptor inhibitor, which will prevent viral entry into the host cell. And similarly, we also have enfuvirtide, which will go and bind to glycoprotein 40, which is present on the virus, and prevents attachment and fusion of the virus. And we have both the types of reverse transcriptase inhibitors, which inhibit the process of reverse transcription. That is, they inhibit the conversion of viral RNA into the DNA. And we have integrase inhibitors. Integrase inhibitors like dolutegravir and raltegravir will prevent the integration of the viral DNA into the host genome. So this process is prevented by integrase inhibitors. Next, we have protease inhibitors. Protease is an enzyme which is required for the conversion of an immature virion to a mature HIV virion. Several polyproteins have to be cleaved by these proteases for producing mature HIV virions. If this protease enzyme is inhibited by using protease inhibitors, then this maturation will not occur. And this is the mechanism of action of protease inhibitors. Okay. Now that we have got an overview about the mechanism of action, let us move on to the next slide. Now let us talk about nucleoside or nucleotide reverse transcriptase inhibitors. All the drugs that belong to this class are either nucleoside analogs or nucleotide analogs. Okay. All these drugs are nucleoside analogs except for tenofovir. Tenofovir alone is a nucleotide analog. This fact can be remembered by observing these two words here. Tenofovir starts with the letter T. A nucleotide has the letter T in it. So tenofovir is a nucleotide reverse transcriptase inhibitor. Now we saw that these drugs are nucleotide or nucleoside analogs. Okay. If they are nucleoside analogs, then they have to undergo phosphorylation before they can be incorporated into the viral DNA with the help of reverse transcriptase enzyme. If it is tenofovir which we are talking about, then tenofovir is already a nucleotide, so it need not undergo phosphorylation, and tenofovir can directly be incorporated into the viral DNA with the help of reverse transcriptase enzyme. These nucleotide analogs will lack the 3' hydroxyl groups, because of which phosphodiester bond cannot be formed, and so chain elongation is terminated. This is how these kind of NRTIs act. Now, coming to pharmacokinetics, all these drugs or most of these drugs are primarily renally excreted, and they require dose reduction in case of renal dysfunction, except for abacavir. And let us look at some adverse effects of this class of drugs. These reverse transcriptase inhibitors, these nucleoside reverse transcriptase inhibitors, are not entirely selective to reverse transcriptase enzyme. Sometimes they also go and inhibit mitochondrial DNA polymerase, human mitochondrial DNA polymerase, especially stavudin and didanosin. That's why these two drugs are rarely used nowadays. And because they go and inhibit this enzyme, we can expect a few adverse effects like peripheral neuropathy, lipodystrophy, and pancreatitis in patients. Emtricitabine produces a very peculiar adverse effect. It causes hyperpigmentation of palms and soles. This looks quite peculiar, right? And abacavir, nearly 5% of the people who undergo treatment with abacavir experience several hypersensitivity reactions, which include fever, rashes, and respiratory distress, and even gastrointestinal distress. A genetic test for this particular gene, HLA-B5701, can be used to screen the patients for this reaction. So this particular hypersensitivity reaction produced by abacavir has a genetic predisposition, and patients can be screened for this particular allele. Now, All NRTIs have been associated with lactic acidosis. Zidovudin can produce myelosuppression, and myelosuppression can manifest itself as anemia, agranulocytosis, or something else. That's it about nucleoside reverse transcriptase inhibitors. Now let us talk about NNRTIs or non-nucleoside reverse transcriptase inhibitors. The mechanism of action of these drugs is different from that of nucleoside reverse transcriptase inhibitors. These NNRTIs go and bind to an allosteric site which is present on the reverse transcriptase enzyme and end up inhibiting that enzyme by the process of non-competitive inhibition. So this is the mechanism of action of NNRTIs. Coming to the adverse effects of this group of drugs, we have to know that nevirapine is a hepatotoxic drug. So whenever you look at nevirapine, hepatotoxicity should come to your mind. Rashes and headache are the more common side effects or adverse effects that can be expected with nevirapine. Efavirenz can produce dizziness, headache, nightmares, and other neuropsychiatric manifestations. So whenever you look at the word efavirenz, neuropsychiatric manifestations should come to your mind. We have another drug by the name etravirin. Etravirin is a second generation NNRTI, and it is used only in patients who are resistant to other NNRTIs like efavirenz or nevirapine. Now let us talk about the third class of drugs, protease inhibitors. All the protease inhibitors end with the suffix navir. For example, we have darunavir, lopinavir, ritonavir, indinavir, etc. Now let us look at the mechanism of action of these protease inhibitors. For the conversion of immature virions to mature virions, there have to be cleavage of several polyproteins with the help of this enzyme, HIV aspartyl protease. By inhibiting this enzyme, by using protease inhibitors, immature virions cannot be converted to mature virions. So this is the mechanism of action of protease inhibitors. What are the adverse effects of protease inhibitors? The common adverse effects of protease inhibitors include nausea, vomiting, and headache. Apart from these adverse effects, we have metabolic abnormalities. Protease inhibitors can produce hyperglycemia, hypercholesterolemia, hypertriglyceridemia, and all these kinds of metabolic abnormalities. On chronic administration of protease inhibitors, there will be fat redistribution from the extremities to the center, and buffalo hump is one of the manifestations which can be seen. So you can see a buffalo hump. Indinavir is known to cause nephrolithiasis. So adequate hydration has to be ensured whenever the patient is under indinavir. Now coming to the drug interactions of protease inhibitors, ritonavir is a potent inhibitor of the cytochrome P450 enzyme system. Ritonavir increases the half-life of all the other protease inhibitors when it is given together. So ritonavir boosted protease inhibitors are often used to increase the half-life of the other protease inhibitor. And it is important to remember that protease inhibitors can cause toxicity of other drugs because they are potent inhibitors of cytochrome P450 enzymes. That's it about protease inhibitors. Coming to the fourth class of drugs, fusion inhibitors. We have enfuvirtide belonging to this particular class. If it's of any help, notice Fu in fusion and notice Fu in enfuvirtide. Right? It should help you remember that enfuvirtide inhibits the fusion process. And also notice that 40 starts with the letter F. This should remind you of the fact that enfuvirtide goes and binds to glycoprotein 40 and it prevents the fusion of viral cell with the host cell membrane. So this is the mechanism of action of enfuvirtide. What kind of adverse effects can be expected in a patient under enfuvirtide? Enfuvirtide is an injectable drug. So injection site pain, erythema, induration, swelling can be expected. Now let us talk about CCR5 receptor inhibitors. We have maraviroc belonging to this class. So what is the mechanism of action of maraviroc? Maraviroc binds to CCR5 receptors which are present on the host cells like T cells. And so they prevent the interaction between glycoprotein 120 present on the virus and CCR5 receptor present on the host cell membrane. So the viral entry into the host cell is prevented. What is the adverse effect of maraviroc? Maravirac is highly hepatotoxic, and often the hepatotoxic reactions are preceded by fever and rashes. And LFT should be monitored in patients who are under Maravirac. Now, let us talk about integrase inhibitors. We have raltic graver and dilutic graver, which are integrase inhibitor. Now, let us talk about integrase inhibitors. We have integrase inhibitors, raltic graver, and dilutic graver. What is the mechanism of action of these group of drugs? They go and inhibit the integrase enzyme, and so the proviral DNA won't be incorporated into the host genome. Okay, that's it for this video. Thank you. If you like this video, like, share, and subscribe.